Hi guys, and welcome back to the channel, where today we're going to be breaking down the fight between Mark and Conquest in the latest season of Invincible. So if you're ready for some broken bones, some blood and a little bit of gore, let's begin. So first up we have a headbutt to Mark's nose, and I'm guessing it's not that invincible. We'll be looking at a nasal fracture, remembering that it's the upper part of the nose which is bone, and the lower part of the nose is just cartilage. And as a minimum, I might expect that the bone might need realigned just to make sure it's straight. And an easy way to tell if a nose is roughly straight is by getting your patients to tilt their head back to see any obvious deviations.
Yes! This! I want more!
So here, Mark dazes Conquest, allowing him to break free from his clutches. But what's happening here is the head trauma causes your neurons in your brain to start firing excessively. This leads to a surge in neurotransmitters, which affects the brain's normal activity, and you then lose control of your normal functions. Hence why Conquest loses his grip on Mark, allowing the fight to continue. Thank God they're both Viltrumites. Had they been humans getting exposed to space, they'd rapidly lose consciousness due to the lack of oxygen, the lack of pressure would cause the fluid in their blood to vaporize, and the gases in their lungs and bloodstream would quickly expand, leading to possible lung rupture and embolisms. But fortunately they're Viltrumites, which apparently allows them to blow blood kisses to one another in space.
You still sure this is gonna go your way?
Damn near certain.
So a further punch to the face, and it looks like Mark takes it on the zygomatic bone as well as around the eye. And the danger with an injury like this is a fracture to your orbital bone. And if that occurs, it can cause your eye to literally sink down into your skull. Clearly, an injury like this would need urgent eye surgery to prevent you from losing your sense of vision. Gosh, getting thrown through a petrol tanker, it's almost like surviving a napalm strike. And clearly you'd expect some degree of burns, ranging from first degree, which affects the superficial layers, all the way down to the bone, which would be a fourth degree burn. In severe cases where the skin gets burnt to the point of being charred, the skin actually needs to be cut open to help relieve pressure on all the remaining tissues.
Stop! Just listen.
Are you crazy?
So Mark is clearly gasping for breath and having difficulty with speaking due to Conquest squeezing his larynx. And if Conquest were to squeeze a little too hard, it could cause a fracture to Mark's larynx, which could lead to a permanent change in the way that he speaks and swallows.
The time I spent killing him might have given you a moment to gather your thoughts. Maybe even outwit me. Where is your Viltrumite heart?
Goodness me, getting your head pushed through several buildings is going to leave you with one hell of a headache. Aside from that, you've really got to be worried about skull fractures, and if the skull does fracture, this could lead to underlying brain damage. An interesting sign to look out for in a skull fracture are bleeding from your ears, brain fluid coming out of your nose, and bruising around the eyes that we call panda eyes. If you see these, you've got to be worried about a basal skull fracture.
Show me your rage! Almost there.
So Mark almost knocks out Conquest with a headbutt, but why is this move so effective? Well, when a headbutt lands, it causes the brain to slam against the skull, a bit like what occurs in a concussion. And a sudden jolt like this can disrupt the brain's ability to control the body, leading to an immediate KO. Also, a strong enough hit to your face or nose can trigger the vagus nerve, leading to a sudden drop in your heart rate and blood pressure, which leads to dizziness and ultimately unconsciousness.
So far, I've been playing with you, getting to know a new toy. Let's step things up, shall we?
So, Mark's getting thrown around here like a rag doll, and it looks like that initial injury has torn his rotator cuff muscles. Now, this can be a pretty nasty injury depending on the amount of muscles that are torn. If it's severe, it could actually leave you with a limp arm, making it very difficult to throw any further punches. However, at the moment, I don't think that's something Mark's got to worry about. He just needs to survive.
It's too easy.
Fun, but easy.
Okay, so we've got some blunt force trauma to the abdomen, and with the strength at which that kick was thrown, you'd definitely be worried about internal organ damage. We could be looking at injuries like a ruptured spleen, a laceration to the liver, and possibly even pancreatitis. Really, this is the type of patient where you'd perform an abdominal CT scan to see the extent of the injuries before prioritising what you need to treat first.
Take a break while I focus on the boy.
So, with a chop to the neck, the first thing you'd be worried about is damage to your C-spine, and if this is severe enough, it could actually damage your underlying spinal cord, leading to paralysis. Otherwise, a well-targeted chop could actually strike your carotid sinus, found in the carotid arteries. This would activate your vagus nerve, dropping your heart rate and blood pressure, leading to a temporary loss of consciousness due to a lack of blood supply to your brain. How did he ever think he had a chance going up against Conquest? But it looks like he's lost all of his teeth there with that blow. Ultimately, you'd be worried about a fracture to both his mandible and maxilla, which will need to be treated surgically, meaning that Oliver's likely going to need to eat through a straw for the next couple of weeks or possibly months.
We're not done yet. You feel your body starting to rip. First your muscles tear, then your vertebrae they separate.
Gosh, this is not the best way to go through a growth spurt during puberty. But goodness me, it's so gory. Certainly you'd expect muscles to tear before joints get pulled apart, but don't forget that you have tendons which help to anchor your muscles to the bone, and these are likely to ping off first. Fortunately for Oliver, if tendons snap, they can be re-implanted back into bone, whereas there's not much you can do if you've torn a muscle other than allowing it time to heal.
I'll eat your heart instead.
So with the force at which that punch lands on Mark's face, you've got to be worried about further facial fractures. We've already seen that he sustained a fracture to his nasal bone and possibly his orbit, but with this injury we've got to consider whether he's broken his maxilla or if he's blown his facial bones apart.
Mark! Get out of here! Go!
Oh god, that's definitely a fracture to the femur, which is said to be the strongest bone in your body. And what's worse is that it's an open fracture whereby the bone is protruding through the skin, which is said to be far more painful. And this would need to be reduced and immobilized fairly quickly, otherwise there's an increased risk of bleeding, infection and amputation if the blood flow down below is compromised. Oh goodness me, like the facial injury wasn't enough, he follows it up with an impalement. Now, the facial injuries could be repaired, however a surgeon's likely going to have to salvage bone from other parts of the body to help restructure the face, but she'll certainly be left with scars. The impalement, on the other hand, is a complete death sentence, as I can't see you surviving a perforation of your aorta. Whoa, that's a close-up I wasn't expecting. But we can see a further open fracture to Mark's forearm. And if this were realistic, you'd probably expect to see two bones protruding through the skin, both the radius and ulnar that make up your forearm. Regardless, this injury is going to need to be reduced, i.e. it needs to be pushed back through the skin and realigned. And to be honest, I don't think Mark's going to be throwing any more punches with that hand.
Getting mad doesn't make you stronger. That's not how it works. Get off me!
Gosh, Mark's really resorting to a last-ditch effort here, taking a bite out of Conquest's trapezius muscle. But the trapezius is a pretty big muscle, so I'm sure he's got plenty left to maintain his function. The main worry is that the human mouth is full of bacteria, and so bites like this can certainly get infected. And with Mark being half Viltrumite, who knows what sort of superbugs he's got growing in those gums. Oh, it's frustrating. Anytime Mark seems to have the upper hand, he seems to have squandered it by not ending the fight. It looks like Conquest was taking a pounding to the right side of his face, and it looks as though Mark was able to achieve this by literally taking advantage of his blind spot. Nonetheless, Conquest resumes his dominance in the fight by fracturing some of his ribs and getting back on top. So it looks like with that energy blast that Conquest has sustained second-degree burns as his skin is literally fried off of his frame. Features that would make me worry that this is a deeper burn is if the skin was completely blistered and bubbled, or possibly even charred. And importantly, a second-degree burn isn't necessarily lethal, meaning Conquest could have survived this, so I hope Mark finally takes his advantage and ends this fight.
Got more than enough fight left in me for you, boy.
Oh gosh, with that injury, Conquest has literally left Mark totally disarmed. On a serious note though, an injury like this is 100% gonna need surgery, as the bones are likely completely shattered. And treatment would likely look at pinning all of those bones straight to allow them to heal, as well as really intensive physiotherapy to allow Mark to maintain some function in that hand.
Is this what you wanted? You enjoyed yourself? Still having fun? Answer me!
I think the good with the bad.
Goodness me, Mark totally pulverizes Conquest's skull here. And I don't quite know how to actually grade this kind of injury, because it doesn't look like there's much skull left, let alone a face for Conquest to repair. I would have to say that these injuries are likely fatal, and it's unlikely we're going to see Conquest again in this series. Okay guys, that concludes the fight between Mark and Conquest. If there are any other fights you'd like me to break down, please leave those down below. Otherwise, I'll leave 2 other videos up here for your viewing pleasure. If not, thanks for watching, and I'll see you in the next one. Thanks.